Hello everybody and welcome to the penultimate episode of Gyne Cancers with the Butterfly Princess and Helen. Today in our penultimate episode, me and Helen are going to be discussing vulval cancer, which is one of the five gyne cancers. So I will pass you on to Helen now to explain what vulval cancer is and where the vulva is located. And then we'll get into like the risk factors and the symptoms and everything in between. So hi Helen, thank you for joining me again today.
Hi, Steph. It's lovely to be here again.
Yeah, vulval cancer. Firstly of all, could you explain to maybe some people watching this today that who doesn't actually know, who might not actually be aware of where the vulva is located?
Yeah, of course I will. And it's a really difficult one, Steph, because quite often people do get confused between the vulva and the vagina. So before I tell you exactly where it is, a little tip. Vulva is on the outside, vagina is on the inside, and vagina has got IN in it. So that's sometimes quite often an easy way to differentiate between the two. So the vulva basically is the name for all the female external genitals that we can see between our legs. So it includes the lips. So the lips of our vulva on the inside and on the outside, the vaginal opening and the urethral opening, which is where we have a wee from, and then the clitoris, which is a little, almost like a little button, which is involved in sexual function. And then we have on either side of the vagina in our vulval areas, we have two called Bartholin's glands. And these are two glands that are on either side of the vagina, and they secrete lubricating fluid. And I guess the key thing is everybody's vulva is different. No two vulvas look the same. Everybody's is completely different. So it's so important for people to know what their vulva looks like and what's normal for them.
Okay, so when we're talking about vulva cancer of the vulva, what sort of things could, because like you've just said, every vulva is different, no one vulva is the same. So what can people sort of look out for and to say that like if something isn't quite right, what are the warning signs?
Yeah, absolutely. So I think it's important to say that vulval cancer is one of the rarer gynae cancers. So we're talking maybe about 1,350 cases a year in the UK. And anybody can have vulval cancer, but the majority of cases are in women over the age of 60. Okay. So there's lots of reasons why it can develop, and we'll talk more about the risks. But the signs and symptoms of vulval cancer, they're not always very obvious. So the most common things to look out for is a persistent vulval itch. So in that external area of your vulva, which we've just been talking about, that those lips and the parts that you can see between your legs. So an itch that doesn't go away, it's there all of the time. Any new pain or soreness in that area, it's not normal to have pain or soreness in your vulva. Um, you can get the patches of the skin on your vulva can change, so they can become thickened or they can become darker or lighter or raised so they feel a bit bumpy when you touch them. You might have an open sore or a new growth on your vulval area. Some people already have moles on the vulva, so if that mole changes colour or shape or starts to bleed, an unusual lump or swelling. And then again, as we've talked about in all of the episodes so far, Steph, bleeding or a blood-stained discharge in between your periods or after the menopause. So that period of time when you've not had a period for 12 months or more.
when you say that, you can sort of maybe look at some discolouring, so like the skin around the vulva can change, or you may have a mole that's always been there, but it may have changed colour. How can people sort of look at the vulva? Because it can be a very tricky place to sort of look at. So
Yeah.
you can struggle to get underneath and part your legs more. So if you have any tips on like how people can get proper access to look for any unbenign signs?
Yeah, absolutely. So the best thing to do everybody's different, aren't they? And some people aren't able to be comfortable on the back, or as you say, Steph, open the legs. So it's about being able to, if you can do that, that's great. So it's about being able to lie on your back. And some women find it easier to stand up, and just a little mirror, a pocket mirror in between your legs, and start by feeling around your vulval area, around the skin, so you get to know what it feels like, and then gradually part the lips back, and then have a look inside your vulvar area and see what it looks like, and be aware of any of those things that I've said. Now, for people who struggle to lie on the back, as I say, you can stand up, but the key thing is really some people decide to use a torch. You can touch and feel, so you do get to know what your skin feels like. So if you know that your skin on your vulva is normally smooth, then if you notice the texture changes, that would be something that we would always say, just get that checked out. And we usually say to women, do it once a month, because we're so good at checking our breasts once a month in the shower. Check your vulva once a month at the same time that you check your breasts.
Of course. And what are sort of like, so we've talked about the symptoms. What are sort of the risk factors, even though it's one of the rarest gynae cancers?
Yeah, so sometimes with vulval cancer, it's hard to know what causes it, but there are some risk factors. So there's a precancerous condition called vulval intraepithelial neoplasia, and it's abbreviated to VIN, VIN. And that is basically means that there's some changes to the cells of the vulva. They're not cancer, but if they were left or not monitored or didn't clear on their own or were treated, then there is a risk of them developing into cancer. And there's two different types of that. So there's one which is called undifferentiated VIN, and that usually affects women under the age of 50, and that's caused by HPV, and I'll come on to that in a moment. And then there's one called differentiated VIN, and that's a much rarer type of VIN, and that tends to affect women over 60, and that can be linked to certain skin conditions on the vulva. And the most common skin condition that's associated with vulval cancer is a skin condition called lichen sclerosis. And I'll come back to that in a minute. As I mentioned, HPV, the human papilloma virus, which we talked about a lot when we talked about cervical cancer, that's a group of viruses that spread through our skin through sexual contact. And most of us will come into some point contact with that in our life, and for most of us, our immune system will get rid of it. If it doesn't clear, then there is a possibility that that can contribute to the development of vulval cancer. So about 4 in 10 vulval cancers are caused by HPV. And then, as I said, the skin condition, so lichen sclerosis, that's an inflammatory skin condition. So it's a skin condition that causes inflammation to the vulval area. And it can cause itching, persistent itching, soreness, very similar to the symptoms of vulval cancer and to the symptoms of VIN as well. But it tends to cause like white patches rather than darker coloured patches. It tends to be white patches of skin. So that's a risk factor for vulval cancer. And then the other one is smoking. And the reason that smoking is a risk factor for vulval cancer is purely because if you've got HPV, smoking reduces your immune system, and if your immune system's weaker, it's harder for you then to get rid of the HPV, which can then contribute to development of vulval cancer and cervical cancer and vaginal cancer, which we'll talk about next time.
Yeah, so say for example, if somebody was listening to this and they noticed something was a bit, untoward for them, and they went to the GP because it's very important to get it checked out by a GP or a health provider. What sort of examinations can a doctor do to sort of look to like maybe take you on a journey to diagnosing vulval cancer?
Yeah, that's a really good question to ask, Steph. So, what would happen is you would go to your GP, and it's always really important so you don't forget anything. We'd always say, write down all your symptoms, how long you've had them, and what's worrying, and never be afraid to say to your GP, I'm worried this might be a sign of cancer. They'd much rather know what you're thinking
Yeah,
than not, and they're not going to think you silly. So what they would do is they would examine you. So they would either ask you to lie down or get you into a position that's comfortable for you if you struggle to lie down. And then they would very gently examine your vulval area. And they would be looking for any signs of skin changes or changes to moles or lumps or swellings that shouldn't be there. Now, sometimes they may decide to take a swab to make sure that there's no infection, because infection can also cause some of these symptoms. As we know, there's lots of non-cancerous causes for these symptoms as well. So they might take a swab and then they might say, let's see what that swab shows. And they might give you some treatment and tell you to come back if your symptoms persist. If they see anything worrying, or if you've already been backwards and forwards to them and things are not getting better, then I would always say, you can chat to them about referring you to the hospital for more investigations, because some GPs are brilliant. They have only so much that they can do, and quite often we need a specialist. So we would either say, advise your GP, speak to your GP about referring you to a dermatologist, a skin doctor who specialises in vulval skin conditions, or to your local vulval clinic, because they're the specialists in vulvas. And then what happens is when you go to those clinics, they examine you, and they usually take, or often they will take, a tiny biopsy of skin to help find out what is causing the issues that you're having. And then depending on that, what that shows, that will decide the next steps in terms of how you're treated.
that is really good information. So if somebody is diagnosed with vulval cancer, what are sort of the treatment options and the success rates of catching it early? And
Yeah, so the key to catching it early is to be aware of your own body, and to, as soon as you notice any changes, is to get them checked out, because the sooner it's detected, if you have got a vulval cancer, the sooner it's detected, the better the chances of a successful treatment. So there's three types of treatment that we would use for vulval cancer. So the main one, and would be used for most people, would be surgery. There'll be some sort of surgery, and the type of surgery depends on the type of vulval cancer you have, because there's different types, and the stage of cancer. Okay. And then what they will do is, once they've, so when we talk about the type, as I say, there's different types. So they might remove a large piece of tissue to try and stop any cancer spreading. They might remove a larger section of your vulva. They might take all of your vulva away. And they might take some lymph nodes. It just depends on what the biopsy has shown and what the consultants see when they examine you. Okay. And then sometimes, if the cancer had spread, then we might sometimes do chemotherapy before we do surgery. Sometimes we offer chemotherapy after surgery alongside radiotherapy, and they would be the three most common treatments that we would offer.
just another question to end off. Like you mentioned that if surgery is an option for the individual, they may remove parts of the vulva. So, if that was the case for somebody, how would they? Because, like, suppose it's like with breast cancer. If you have breast cancer, you've had your breast removed, then it's sort of adapting to like loss of loss of feeling in that area. So what about down there? Because obviously it is a big part of like the female genitalia. So
Yeah, absolutely. And that's such a key, a really key point, Steph. So, with any cancer diagnosis, there is an emotional, psychological impact, particularly with something like a gynae cancer and the vulval area, because it's so key to sort of how we view ourselves. And for
yeah,
many women, that's sexual function. And living with and beyond vulval cancer affects many areas of your life. So, and some people do have issues with their sex life after they've had, either part or all of their vulva removed. So it's so important that people get the information and the support and the help that they need. So, it sometimes it's an option when the original surgery is done to have a reconstruction. It depends on the cancer and how far it spread. So to reconstruct the vulva, other times it isn't. And then it's about offering that specialist psychological and sometimes psychosexual support, emotional support to women to enable them to feel better about their bodies. And there's lots and lots of support that we can offer for women who need that. And also it's about, with any cancer treatment, there's also that risk of treatment side effects because of the area, particularly with radiotherapy that we're treating. It can become quite sore and uncomfortable. So all of those, there's support available and treatments available to manage anything that affects, women after they've had either from when they're diagnosed or further down the line, because it hits people at different times, Steph.
of course. Well, thank you, Helen. This again has been really informative, and I look forward to doing the last episode on vaginal cancer. But don't worry, everyone, this won't be the last time me and Helen work together. We've got plenty of other topics to discuss in other series, so there'll be more to come. So I'm going to sign off now. Thank you again, Helen, and thank you everyone for watching.
Thanks, Steph. Bye,
Thank
everyone.
you. Bye bye.
Bye.